are listening to Why I Vaccinate, and I am here now with my co host, Veronica McNally. And this is our opportunity, Veronica, to get to know each other and have our listeners get to know you. So, start out and just talk to our listeners a little bit about why you started this.
Well, in 2012, I lost my infant daughter, Francesca Marie, to pertussis, also known as whooping cough. And at that time, we knew we wanted to raise awareness about whooping cough. And it was just a short while after we began that process that we realized it was really important for parents to understand the way that vaccines can save lives. And so we broadened the mission to educate about all vaccines and vaccine preventable diseases.
So, talk a little bit, Veronica, about this journey. You started in 2012 and just kind of go through some of the high points, some of the low points of the journey.
So in 2012, when we began, I did a lot of speaking engagements. I did grand rounds at hospitals. I went to immunization meetings to try and reach some of the medical assistants and pediatricians and nurses at provider offices. And it was really just a few months after this work began that I saw a TED Talk with Melinda Gates. And she talked about what nonprofits could learn from Coca-Cola. And what she said is that they had really inspirational messaging, that they had real-time data, and that they had local talent, basically. And it just kind of struck me that that was what we needed in vaccine education. We needed to have a pro-vaccine, if you will, voice talking about the benefits of vaccination, about the safety, the efficacy, and to really have moms saying, I do this, as opposed to having moms saying, I'm hesitant.
So, what have been some of the successes of I Vaccinate along the way? It's been 9 years.
So the campaign design began shortly after Francesca passed away. So that's when I sort of started thinking about what would be helpful. We began focus group testing with Michigan moms, the I Vaccinate, the concepts of what we really wanted to communicate to parents. And it was amazing to see the responsiveness. And it was just a couple years later that we were fortunate enough to partner with the Michigan Department of Health and Human Services to launch the I Vaccinate campaign. And since March of 2017, the response has been incredible. So I just want to give you some of the numbers. We have had 710,000 visits to ivaccinate.org. We've had 663,000 engagements on social media. We have more than 50,000 followers on our iVaccinate social media channels. This year, we have 50 bloggers lined up because our readership is so great in that circle. So we are just reaching parents and helping them understand the benefits of vaccination, and the science behind these vaccines. And we're just really proud to do this work.
What are some of the reasons that this is so effective? Like, what's going on here that this campaign works so well?
I think that it probably is sort of that mom to mom conversation that people are having online. And I think that it's the ability to access information easily to help parents get comfortable with the idea that they're going to vaccinate their children and that these vaccines are going to really help their kids. So I think that it's a combination of the easy to access information and seeing it everywhere, seeing it on social media, seeing it on Facebook, on Twitter, on Instagram.
So, Veronica McNally, when you have a parent come to you and say, why should I vaccinate my kids? What do you say to them?
I say, what questions do you have? Because I want to identify their specific questions. They might have one question about one vaccine, and that is preventing them from feeling comfortable enough to make the decision to vaccinate their children against either just one of the diseases or all of them. And we need to isolate that, and we need to find out what that is, and we need to answer that question or those questions that they have.
And you and I both over the years have heard of the campaign against vaccinations. What are your thoughts on that? And how does I Vaccinate deal with it? Because sometimes, depending on the time of year, we hear a lot about this, Veronica.
Well, I think it really boils down to misinformation, and that misinformation is creating hesitancy. And in 2019, the World Health Organization actually listed vaccine hesitancy as one of its top 10 global health threats. So it's not insignificant. And the reason why information like this that we put out, that credible scientific information, is so important is because it's going to help parents get past their concern that they're seeing, put out there that might not be factually accurate.
Now, there is a lot of science and a lot of testing and a lot of research with regard to childhood vaccines. Talk about what you've learned when you started this or along the way as part of your journey, Veronica.
Yeah, I mean, I've learned that it's okay to have questions, that it makes you a good parent to have questions. I've learned that it's important to find credible information, and to for us on the side where we want to do that service for people, that it's important for us to get the information into the hands of parents and meet them where they are. But I think as a part of this journey, what I've really learned is the information parents need, and they need to see that science. They need to see that vaccines are really well tested, that vaccines continue to be monitored, and that vaccines work.
What's been the most rewarding thing about being involved in this campaign for you?
That I get to honor my daughter's legacy every single day, and that I get to work with this incredible team of people who make this happen.
So, what's next for the I Vaccinate campaign? What are some of the plans that listeners can expect to hear about?
Well, we're really excited about the next phase of I Vaccinate. The next phase of I Vaccinate is a provider toolkit. So parents can go into their provider's office. They will be met with a provider who has the same resources at their fingertips that we know are so important and that we use in our I Vaccinate campaign on the public side. A parent can tell the doctor their specific questions that they have, or their nurse or whoever it is that they're with, and they're going to get a customized takeaway that they will have that will answer their questions based on that credible scientific information.
You know, your numbers have been pretty significant, the ones that you gave us today with regard to the number of people that have reached out to you into the I Vaccinate campaign. What are some of the good stories, the interesting feedback that you've gotten from parents after you've helped them with their questions?
Yeah, I mean, I think the most common thing that we hear is that because of the stories that they heard, because of the moms who connected with them, because of the dads who they saw taking, their kids to the doctor's office, that they got more comfortable, that they vaccinate, and that they're proud to vaccinate.
And as we do this show over the next couple of months, what are some of the key points that you want our listeners to take away?
Well, we want to touch each show on what are hot button issues in vaccination. And we want parents to be able to get that important information. So today we talked about the COVID-19 vaccine, and today we will hear from a pediatric cardiologist about myocarditis, which is an issue that's happening right now in COVID infection and possibly in COVID vaccination. So we really just want parents to get the relevant information in any way possible, and I think that this podcast is such a great addition.
You know, it sounds to me too like you have had a lot of support from a lot of different areas from the moment that you started the I Vaccinate campaign.
Yeah, we have, and we've been really fortunate to have that support. So we have a number of partners across the state and across the country. So nearly every single medical association in Michigan is a partner of ours. And every time we decide we want to have a press conference to talk about back to school vaccination, for example, or the importance of COVID vaccination, these medical partners come and they support us and they talk with us and they help parents in the way that we know that parents need to be helped.
And Veronica, I love that you've got the family involved in this. So they are fully on board with vaccines. Talk about that.
Yeah, so I have 3 boys, and my boys are really proud of the work that I Vaccinate does. And when we talk about vaccination, they always want to make sure that they have their flu shot, that they are able to really fight these diseases. And my youngest calls the vaccines little ninjas who are fighting against the disease.
Oh, it's just so great. It draws a wonderful picture, Veronica.
It does.
It
It
really
really does.
does. You are listening to Why I Vaccinate. Coming up next, we are going to talk to Dr. John Sharpie. He is a pediatric cardiologist with Michigan Medicine, and he's got some great information about myocarditis and the COVID-19 vaccine. We'll be back right after these messages.